Good morning, and welcome to Black River Memorial Hospital. My name is Jesse Susa. I'm here in this video to explain the procedure of the colonoscopy, the risks and benefits of the procedure, and to introduce you to myself. So again, my name is Jesse Susa. I grew up in Oliva, Wisconsin. I went to Oliva Strum High School, attended UW-Madison for my undergraduate training, and throughout my undergraduate training and during my medical training at the University of Minnesota in the Twin Cities, I always had a passion for primary care and disease prevention. And so I get to live my dream job today by helping you prevent and screen for colorectal cancer. I started doing colonoscopy in 2014, was licensed to practice medicine and surgery since 2017, and began practicing here in Black River Falls at Black River Memorial Hospital in 2019. By now you should have completed the most difficult part of the procedure for most people, which is the bowel prep. By now, your stool should be a liquid yellow, and you may need some additional preparation if that's not the case. So if you did not have a liquid yellow stool this morning, please let myself or your nursing staff know. Let's talk about the colonoscopy procedure. In a colonoscopy, we use a flexible tube called an endoscope to visualize the entire large bowel, also known as the colon, from the beginning at the ileocecal valve all the way to the end, the rectum and the anus, where stool exits the body. We may take samples, and if we do see precancerous polyps, we will completely remove any of the suspicious-looking polyps. This is typically done while we are removing the scope from the colon. During this procedure, you will have sedation. We use a form of anesthesia called conscious sedation. You will not need a breathing tube or be made completely unconscious or paralyzed during this procedure. The anesthesia is provided to relieve anxiety and apprehension and provide comfort during the procedure. Often you will fall asleep or be forgetful for most of the procedure. You should have minimal pain during a colonoscopy. It is well tolerated by most people, but if you have had any issues with anesthesia previously, please let us know. There can be side effects of nausea, itching, or other mild side effects associated with these medications. Let's talk about the alternatives to colonoscopy. Stool testing is an option in which we look for immunochemicals or DNA markers in the stool that can be precursors or evidence of colorectal cancer in the colon. This is a good choice for low-risk individuals. Low-risk individuals are those who have no family history of colorectal cancer in a first-degree relative, such as a sibling or a parent. However, colonoscopy is the preferred alternative in higher-risk individuals because we prevent colon cancer by removing precancerous polyps. There is another alternative called CT colonography. This is considered a second-tier testing as an alternative for individuals who do not tolerate or do not qualify for colonoscopy. This is a special CAT scan that uses X-ray images of the colon after the colon has been inflated with gas to detect colon polyps. However, if you have a positive test with either the stool-based testing or the CT colonography, all roads lead to colonoscopy. A colonoscopy is recommended for anybody who has a history of an abnormal colon test screening for colon cancer. This is why colonoscopy is considered the gold standard for colorectal cancer screening and really should be considered for all individuals who qualify. There are some risks associated with colonoscopy. The first risk is bleeding. Less than 1% of the time, individuals will come back after a colonoscopy having some rectal bleeding. We do expect a very tiny amount of bleeding if we remove a polyp, and this may occur as tiny streaks of blood in the stool or a little bit of blood on the toilet paper. However, any large amounts of blood, clots, or anything that seems out of the ordinary to you should be reported to us immediately. Most of this type of bleeding that occurs after removal of a polyp can be resolved without additional surgery, and 90% of the time it simply requires close monitoring. A second type of complication of colonoscopy is injury to the colon. This is quite rare, occurring less than 1 in 1,000 colonoscopies. It can usually be repaired during the time of the colonoscopy by putting clips on the polyp site where we had removed the polyp or where the perforation occurred. It usually requires that you stay in the hospital at least one overnight for monitoring. In some patients, it does require additional surgery to repair the perforation, but this is very rare. Another form of injury to other organs is extremely rare. One complication that may occur is a misdiagnosis. We do our very best to detect every colon cancer and every precancerous polyp. However, even the best endoscopists can miss some polyps. At the Crohn Clinic and Black River Memorial Hospital, we hold ourselves to very high standards when it comes to the detection of precancerous polyps. And so we track our performance based on criteria set by the Surgical Collaborative of Wisconsin and the national standards set by the Multi-Society Task Force for Colorectal Cancer Screening. The minimum standard for precancerous adenoma polyp detection among women and men is 25%. And in 2021, I reported an adenoma detection rate above that at 41%. So remember, most people do very well and tolerate the procedure very well. 20 to 30 colonoscopies are done every week here at Black River Memorial Hospital. You have a very well educated and experienced staff to support you through this procedure today. After the procedure, you will come back to your recovery room. We will get you some food and drink. You might feel sleepy or forgetful due to the lingering anesthesia, and we recommend that you do not drive or make any important decisions after the procedure for the remainder of the day. You may have some mild gas pains and bloating from the carbon dioxide we use to inflate the colon, but this should resolve over the course of just minutes to hours. You will be able to go home once your nursing staff observes that you are doing well and your vital signs remain stable. I will meet with you personally after the procedure to share photographs and the results of your procedure. If biopsies were taken, it will usually take 1 to 2 weeks for these results to return to you, and I will report these almost all of the time in the form of a letter that will arrive at your mailing address. I may call you or ask you to see me in clinic if we need to discuss any more concerning results. If all results are benign, again, you will receive a letter with a final recommendation as to when to repeat colonoscopy, if ever, in the future. And this is usually within the range of 3 to 10 years. If you have reached an age in which colonoscopy is considered optional, I will simply recommend that you have a discussion with your primary doctor at the time in which colonoscopy might be recommended. You should report back to me if there are any concerning symptoms such as bleeding, pain, black stools, or lightheadedness after the procedure. This will usually occur within the first 1 to 2 days after the procedure. If the Crohn Clinic is closed, you should go straight to the emergency room for evaluation, and you will be seen by the doctor or surgeon on call there. So again, my name is Dr. Jesse Susa, and thank you for watching this video. We look forward to providing your colonoscopy here at Black River Memorial Hospital today.